introduce Dr. Rob Rutledge. He's going to talk about the mind-body connection, empowering yourself on the cancer journey. Rob is a radiation oncologist and associate professor in the Faculty of Medicine at Dalhousie University here in Halifax. He's a full-time practice, specializes in breast, prostate, and pediatric cancer. He is also a dynamic and heartful professional speaker, combining scientific knowledge and insights gained from serving people dealing with life-threatening illnesses. He has touched the hearts and minds of thousands with his compassion and wisdom over the last 20 years. And he started all this from receiving a life-altering experience. He knew that early in life that he wanted to serve people, but as a young medical student, he didn't know what type of doctor he wanted to be. Then one day, a book jumped off the shelf, and the book was called Love, Medicine, and Miracles by Dr. Bernie Siegel, an Ivy League cancer surgeon and pioneer in support groups. Dr. Siegel wrote about his exceptional cancer patients, those who responded better to treatments and lived much longer than expected. Dr. Siegel found his exceptional patients had similar personality characteristics. They were able to truly accept their diagnosis, saw their cancer diagnosis as an opportunity to prioritize their life and put their energy into things that they can control, such as attitude and relationships. After reading that book, Dr. Rutledge knew he wanted to become a cancer doctor and run support groups. And he has gone on to develop and deliver workshops, speeches, retreats, internationally teaching people complete cancer care. His skills, which maximize their chances of recovery and healing at all levels of the mind, body, and spirit. So welcome, Dr. Rutledge.
Great. Thanks a lot, Richard, for that introduction. I'm actually here with my esteemed colleague and good friend, Dave McGinley. I know, Dave, you want to introduce yourself when you come up here as well. So just want to realize that there's a wise person here as well. So first of all, I got you to stand up. Why don't we just stand up for one more second? I just want to show you something before we actually start this presentation. So I was on live at 5, I know, a month ago, 2 months ago, and so I was nervous. I give a lot of interviews, but I've heard this trick. Can you assume the power position? Go like this, hands on hips, like this. So simply holding yourself there for like a minute or two actually changes the chemistry within your body and your brain. And people are more confident and more peaceful after they've been in the power position. So if you're going into a medical appointment, for instance, you can actually do this, and then you'll have stronger, be more confident, be able to interact with your oncologist or whatever more easily. Going into a job interview, do the same thing like 2 or 3 minutes beforehand. It's kind of weird to do that in the waiting room or in the bathroom, whatever. But honestly, you'll change your physiology and change how you feel. I gave a better interview, so thank you for doing that with me. So I'm excited to give this talk. A lot of young men who are diagnosed with testicular cancer are young, and so there's actually an opportunity here to empower yourself, to learn the kind of neuroscience that shows that you can change your brain in a way that actually makes you feel better and happier, ultimately. And so there's this opportunity to learn about the mind-body connection. The other one that we're going to talk about today is the fact that it is normal to be stressed, it's normal to be upset, it's normal to have fears in one's life as you face a cancer diagnosis. And so then how do you work with that? That's really what we've been charged with today. How do you empower yourself? How do you change your brain chemistry and physiology so you can feel better and function better overall? So we're going to work with those normal emotions, and that we can accept that that's a part of living, part of life. And so to learn these skills at such a young age can make a huge difference in your life. This is what we're going to cover. I'm going to talk about some practical neuroscience. Very, very exciting. The fact is that you can feel better. And we're actually going to go through some skills here as well, so you actually get a taste for the things you can do to make a difference in your lives. Now, what I've noticed giving lots of talks in support group facilitation is that people who've been diagnosed with cancer want essentially three things. They want to maximize their chance of cure or longevity. They want to feel better physically, they want to recover, but emotionally, they want to kind of get their feet back on the ground again. And that's probably what we're going to work with most today, is the kind of emotional issues and how can you kind of get back to feeling normal again in some sense. And lastly, how can you get your brain to work in a more effective way? That one, as a young person and maybe not getting chemotherapy, you don't have to worry about as much. But essentially, the advice I'm giving is going to do all the above in one go. And so I believe in what I call complete cancer care, which is this idea of integrated medicine. The idea is that you want to get the best from the medical system, and then you want to combine that or integrate that with what you can do to empower yourself at levels of body, mind, and spirit. So the two together actually give you the best chance of having your brain function better, to feel better, and actually get the best chance of cure. And it's the power of coming to this type of presentation or listening to this video, for instance. So at the highest levels, to understand the language, understand the perspective, so that when you're interacting with your physician, you know what they're talking about, that you can be a participant in that conversation. So that's the first level, is just getting the language down. The second level is actually negotiating the medical system, figuring out how that machinery works, and so you can get the best possible care. And I can't go into all of this now because that's a 20-minute talk by itself. But realizing there's lots of different experts within the system, including a nutritionist is an expert within the system. The librarian is an information specialist. There's lots of other people who can help you understand and empower yourself because of what they offer. And then going into that appointment, being prepared, writing down your questions, bringing somebody with you, lots of other tricks of the trade that you can do to make sure that the medical system is giving you the best care, including learning from the great experts here as well. And then a little bit of back and forth now. So the next level is level of body. What can you do to maximize your function in your health in terms of what you do in the day-to-day? What are the things, and I want to hear the answer from you right now. What are the habits? Exercise, number one, for certain. Healthy diet's number two, agree. But we're going to go for the exercise just quickly, just to touch on it. So how much exercise do you need? What's the recommendation? An hour a day is actually good. It's 150 minutes per week at a certain intensity as well. You want to work yourself towards that. Exercise is absolutely number one in terms of changing the physiology. So people who are stressed or depressed, you actually release the happy hormones during exercise. And so instead of taking an antidepressant, actually exercise seems to be as good as changing that physiology. During exercise, you release a chemical in your brain called brain-derived neurotropic factor that allows you to remember better as well. So you want to do better in school, better at work, et cetera, et cetera. Exercising actually improves brain function, improves energy, improves sleep, improves quality of life. I could rant. I really could rant about exercise. It is the panacea in my mind. So do what you have to do. Figure out the tricks that trick your body into getting out there and doing that exercise. So number two was nutrition. And so what are the aspects of nutrition? How would you describe that diet that's healthy for you? Yeah, don't eat like me was the comment. High in fruits and vegetables, which are the antioxidants, mop up the chemicals that cause more damage. For instance, what do we need in Canada? Vitamin D. We only get, probably 2 months a year we get enough of it otherwise. Again, go see a specialist. I can't spend the time on that one. Number three is maintain a reasonable weight. Number four is actually sleep, right? And as young people, we often don't do well at that. There's something called sleep hygiene, which are the kind of habits that you do going into a night's sleep that allow you to maximize your chance of getting a great sleep. And what would be some of those ideas? What can you do to help yourself get a better night's sleep? Yes, so no screen time for that hour beforehand because this kind of blue light inhibits the sleep cycle. You want to have the lights getting dimmer with time as well. Stay away from the stimulants, the exercise, chocolate, caffeine, those type of things. Keep your light down during the night. So 90 seconds of bright light inhibits melatonin, which has an influence on releasing healthy hormones. So you want to have eye patches on, keep the lights on, off at night. Again, there's lots there that you can do. Number 5 is what? What else can you do that actually has a profound influence on how your body can heal itself and regenerate and so on? I know, read my mind, ESP. It's relaxation, practice a relaxation technique, and that's part of what I'm going to talk about today. So that's a profound one that we in the West don't understand and do very well. It's actually practicing relaxation technique. We're going to focus on here is level of the mind, the skills of healing the mind, realizing that it's all interrelated, and nurturing your spiritual life, a bigger perspective in whatever way is best for you. So that's the overview, what you can do to empower yourself. And if you do all those things, then you can relax and say, I've done everything I can. And then you let go of the things you cannot control, which is the other part of the mind level. So we're thinking about healing skills and the mind-body connection, but there's also the body-mind connection. So we're thinking about how the mind, your thoughts, influence your physiology, but your physiology can influence your thoughts, just like we did standing up, right? The power pose. So the fact is that our gut and heart even are surrounded by nerves that feed up to your brain. And it's the other reason why you want to physically take care of your body, because if you're rested, you're well exercised, and you're taking care of your gut, you'll actually feel better neurologically. Your brain will function better. So the other one is, wake up in the middle of the night and you're anxious, you're thinking about that next medical appointment, next scan or something like that, and you're feeling nervous. What do? So you can actually practice a relaxation technique, right? So into your breath, change the physiology over, we'll talk about later on. So again, you're allowing your body to influence your mind. You're tapping into the body's innate abilities. So you want to take care of your body. It's really the bottom line in all of this. So I'm tapping into the teachings from this gentleman, neuropsychologist essentially, and a couple of excellent books, Buddha's Brain and Hardwiring Happiness. Rick Hansen is there. But essentially he's tapping into the recent neuroscience. Our understanding of the brain has doubled. The amount of information we know about the brain has doubled in the last 20 years compared with the previous 20 years. It's just an amazing, and it's on the exponential growth rate now. And I believe in something called evolutionary biology, essentially that we're the product of evolution. And if you think about it, you have a nervous system that has developed over the millennia, millions of years, going from less complex to more complex. So even 2.5 million years ago, our ancestors had brains a third of the size of our brains today, and yet they were able to make stone tools. And as the evolution continued, who has green or blue eyes? Here, raise your hand. You guys are mutants. So even 6,000 years ago, there were no green or blue eyes. And then one guy in Denmark had a mutation, and then he was very popular over the decades. And that's the rest of us. So, and then this is actually very important. It's the idea that we spend a lot of our evolution in tribes of 100 and 150. So there's evolutionary advantage of our tribe doing better than the next tribe. And that means two things. One is that we have precious resources, so we have to work together, a lot of empathy, connection, community. And that's a lot where our brain grew. But also there was competition, so competition with other sides. We have this kind of warring aspect to ourselves as well. The young men have this kind of tribal feeling. So that's us. And then a young man's brain definitely matures more slowly. Up until about 25, you're still kind of putting down myelination forward into your brain tissue. So the idea is that our brains are the product of evolution, and understanding your brain, therefore, can understand why you have a stress reaction, why we have fears, et cetera, et cetera. And so you can think of the brain as growing like building a house. You have to build the kind of foundation and base first, which is more the reptilian brain, which is the fight or flight response. And then the next level is the mammalian brain, which is kind of more to do with emotions and rewards and so on. And then lastly, through evolution, we kind of put on top the kind of top level, which is the neocortex, the higher level functioning executive function and so on. And I'll show you that as a hand model shortly. But essentially those kind of physiology of your brain taps into various systems. So you have the kind of primitive reptilian brain that's basically preservation of life, fight or flight, and so on. The next level is basically sex and food and, kind of approach level, mammalian, which is kind of starting to get more complex in terms of social relationships. And then lastly, we have this kind of higher level bonding language, and then empathy, connection, and so on. So that's part of our brain, and we can tap into this. The issue, though, is that every aspect of your brain will tap into the other two to support its own means. So I tell you all that so that you understand why you can get a stress reaction, why you can feel that jittery, upset, stressed out feeling by different types of stimulus, different types of stressors. And so there are many pathways to feeling that kind of sudden, stressed, upset, angry, flustered feeling. If you're walking down the street and a car's coming at you over the curb, an errant vehicle, then you will have a stress reaction. Your reptilian brain will give you the fight or flight reaction, and you will jump out of the way. That's what we've been programmed to do. But that same neurochemistry, that same physiological reaction will be primed if you're suddenly told you have a testicular cancer diagnosis or a cancer diagnosis. Suddenly, we think about our mortality, and that's really one of the main issues around fear and anxiety, is this worry of dying. And that's normal, natural, and you get the same kind of stress reaction out of it. And yet, there's other levels there. So for instance, from a social perspective, if you're on the Serengeti, the desert, and you're in your group of 150, and you're ostracized from your group, that's a death sentence. And so you'll have the same stress reaction. And that's why if you're in an argument or you're not getting along, your boss doesn't like you, or those type of things, you get the same stress reaction because the body's basically saying, oh, I'm not part of the group now, I could die here, essentially. And so that will also make you feel stressed. And then just lastly, through evolution, we've always had this worry about trying to figure out what's going to happen into the future. And so if there's unknowns, we kind of ruminate on what's going to happen. And so that's why we feel a little bit stressed and jittery around fear of the future itself. So I'm pointing out the true physiology because it's normal and natural and it happens to us. And we in the West don't talk about it, and especially guys don't talk about their fears and anxiousness and stress and so on. So I just want to kind of normalize that your brain is set up to do all this stuff. So just the explanation of stressor. So stressor is the thing that causes a stress reaction. So whether the tiger is behind bars in a zoo or you're in Siberia and you see it for real, it's two different types of reactions, or perceptions at least. But the body's physical reaction is kind of classic in terms of a couple of chemicals that are released, adrenaline and cortisol. It's the fight or flight chemicals. And so whether you trick yourself into believing that there's a problem, or if there's, you really have to jump away of the taxi, your body's going to suffer the same chemical reaction and your brain doesn't work as well. So there's lots of reasons why stress is not good for us, because it really literally eats away at the tissue, the adrenaline, cortisol, and so on. And it causes a lot of inflammation and problems in any system. And I don't have the time to explain all those systems. But also the way we think actually changes. We get much more concrete and irritable, and we want to solve the problem quickly. So how we think changes when we are stressed, and we lose the capacity to kind of use their higher level thinking and function. And so this is kind of going to be kind of like high school right now. I want you to be able to whisper to somebody right now as I ask you these questions. So it's almost like audience participation, but you're going to chat with each other around this. So we'll have the two physicians, because will have a different set of stress, chat. But you guys chat amongst yourselves, essentially. What are the situations that kind of cause you stress? What are the sudden flusters? Is it walking into a medical appointment? And I want you to chat and whisper as I'm talking. So just go for it. Just chat with each other. So what are the triggers? Is it a home life situation? Is it a dealing with your spouse or kids or work? Somebody being angry with you? Flustered? Okay, so what is it? Recognize your stress. Okay, in that moment, what are the stress symptoms that you get? What happens to your body physically? And again, you're gonna chat to each other, but I'm gonna talk over you as well. So just keep on going, chatting. You get a kind of pounding heart, short of breath, kind of flustered, sweaty palms, headache, jaw ache, neck ache, gut ache, shakes, feeling you got to go to the bathroom, diarrhea, that type of thing. Okay, good. What emotions? How would you describe your emotions in that moment when you're suddenly flustered? It could be angry, red, upset, numb, sad, feeling like you're going to cry. How would you describe your emotional reaction when you're in that moment? How does your thinking change? Do you kind of numb out? Do you become more concrete? And what happens to your thoughts? Do you recognize yourself swearing in that moment? Are you labeling other people? Are you labeling yourself? Are you labeling life? What is that you see and feel when you're like suddenly flustered? And how do you recognize your thinking? Okay, thank you. Thank you for chatting and do this exercise. Now, I'm taking you through all this because if you don't recognize some sign that you're suddenly stressed and flustered, you'll miss out on the whole opportunity to settle your physiology down. Right? So if I hear myself swearing, I know there's an issue in my mind. If I'm swearing in my mind, I know that I'm upset and flustered and frustrated. But other people could be just like an nasty stomach, or oh geez, I'm feeling slightly short of breath, or I'm starting to say these thoughts in my mind. So the recognition phase is absolutely essential, because the longer you go on your stress reaction, the more and more upset and flustered you'll feel. The earlier you can recognize it, the earlier it is to settle down. Now the challenge is still there. You still have to deal with the situation, but it's a lot actually easier to deal with almost any situation when you're in a more peaceful state, because you can use that kind of higher level of thinking. You'll be more logical and obvious, and you'll be more creative and so on. And yes, you need to use your strength and your courage or whatever it is you can draw on, but oftentimes it's easier. Okay, so we're going to do an exercise together. So actually I'm going to ask you to stand up again, if you would. Thank you. So imagine yourself going into that situation. Maybe it's walking into a medical appointment, or you have to go deal with an angry person, or you have an evaluation with your boss, or maybe it's a job interview, something like that. And in that moment, you recognize, oh, geez, I'm feeling a little bit stressed here. However it is that you recognize. So the idea is, as you kind of remember that, I want you to put your hand on your lower abdomen, and I want you to take 4 slow breaths. And just be very curious about what that feels like. Like, what does it feel like to breathe? What are the sensations? And if you want, you can do a longer out breath and a slightly shorter in breath. Okay, great. Now, at that point, you've actually tapped into the vagus nerve, which is the nerve that goes to the diaphragm that helps with breathing. The vagus nerve sends a signal up to your brain that says, I'm okay, I can relax right now. And then what you do is you use the kind of higher part of your brain to say, yes, this is a difficult situation, but I've been through difficult situations before. I can use my courage or insight. It's better for me to be in this more peaceful state. So, okay, you can have a sit again. Thank you. So just to teach this again, if you can recognize the situation, you press the pause button, because a lot of the time, 99.9% of the time, you don't have to snatch the child from underneath the car. You can actually just have that few seconds of breathing, so the 4 slow breaths. Be very curious. When you use your curiosity using a different part of your brain, slow breaths changes over the physiology, and then you can reassure yourself from that kind of more higher aspect of yourself with wisdom and kindness. So that's the sudden fluster feeling. You can actually settle yourself down and just continue on with your life there. I'm just going to finish off this part of the presentation talking about the fact that your brain is the organ that can change, that you actually program your brain to be in a state or different types of state and be better and better at it. And the reason why you can do that is that your brain has basically about 85 billion neurons that have connections with 5,000 other neurons on average that fire 50 to 5,000 times or 50 to 500 times a second. So it's this very active circuitry that continues to change throughout your lifetime. So it's the most complex organ that is known or issue or thing that's known to man. The synapse also releases specific chemicals between one neuron and the next neuron, so we have an influence on those neurons. So the brain is the thing that can change itself. So it does that by, so for instance, if you practice being stressed, you get very, very good at being stressed throughout your lifetime. If you practice relaxation, your relaxation pathways will start to set down and the stress pathways will start to decrease, right? So you get good at whatever you practice. If you practice being cranky, you'll be good at being cranky. People can get more and more constricted as they go through the years. Or if you practice being peaceful or grateful or positive or joyful or whatever it is that you want to manifest in your life, your brain will actually change to manifest that. And that's called self-directed neuroplasticity. Essentially the idea that you can really change your brain into whatever way that you want it, kind of like reverse engineering here. And I'm going to finish kind of this part of the presentation with this idea of meditation. Very simple way to kind of bring yourself back into a relaxed state. So I'm talking about the sudden settling down. That's the kind of acute stuff. But you can actually reset your whole stressometer into a different state if you actually practice relaxation every day. So even 30 minutes a day has a profound influence on the kind of general stress levels there. And as you practice relaxation, so I simply go down, watch my breathing each morning. I realize that my mind is chattering and I bring my attention back to my breathing. It happens dozens of times, as I go through this meditation practice. The days I meditate, I feel more positive, more peaceful, more compassionate. And the scientific data basically supports the fact that if you practice relaxation, you'll be in a better state and more functional, better quality of life. And just, again, I don't have the time to explain the incredible benefits of meditation, but I do want to show you the hand model, which is, so essentially it's your thumb is the brain stem here, the base of your thumb, and then the top of the thumb is the kind of mammalian brain, the limbic emotional system, and then the third part of this is the neocortex that kind of wraps over top. And you can see the kind of intimate association of the prefrontal cortex here overlapping the limbic system. So when you get upset or flustered, it's actually your neocortex that's recognizing that and it can kind of dampen down the mammalian system. And people who practice meditation, their prefrontal cortex gets thicker over the years, and that's associated with positive emotions, happiness, essentially. And it's as if the other dials within the brain are set down lower, and so you're able to actually attend to what's actually happening in the moment, which is a very powerful way to be. So that's kind of introduction to some of the ways that you can kind of empower yourself at the level of the body and how you can kind of settle down the kind of the stress reaction. That's a normal human thing to do. And so I think I want to invite my good friend Dave McGinley up here to talk about setting of an intention, and maybe I can set it up as Dave is coming up. The idea is, whenever you're going into a situation, whether it's into a job interview or whatever you're going to do, you can actually think about what's your priority. And without that kind of setting of your priority, you can kind of get pulled off one way or the other. So you can actually decide, I want to be confident, I want to get the best care possible or whatever it is. first thing in the morning, how do we want to be in this world is essentially it. So we're going to actually practice just a quick little meditation, relaxation, visualization, whatever day wants to do, to actually practice and experience a relaxation technique as well. So.